This question deals with a 9-year-old male is brought to your office by his mother who notes progressive edema over the last several weeks. The mother also remarks that the boy's urine has been progressively foamy recently. Urine analysis shows massive proteinuria, but is otherwise unremarkable. Which of the following secondary changes is most likely in this patient? So this is an obvious case of minimal change disease. First of all, someone who is 9 years old having foamy urine, meaning they're losing a lot of protein and a lot of fat in their urine. And if they're 9-year-old and they have lots of protein, the only option there is minimal change disease. That's a most obvious one that stands out. Now, which of the following secondary changes is most likely in this patient? So we are interested in the secondary changes. A, decreased plasma aldosterone level. B, increased renal sodium wasting. C, increased capillary hydrostatic pressure. D, decreased liver albumin synthesis. And E, increased liver lipoprotein synthesis. So options kind of explore one thing. It's a concept of what happens in minimal change disease. So let's go from the beginning. What happens when there is effacement of podocytes? There is going to be loss of negative charge. As a result, we're going to start losing proteins. But this is going to be selective loss of albumin. Albumin is the only one which has negative charge, and because the negative charge of the basement membrane is gone, as a result, albumin will not be repelled by the negative charge and we're going to lose albumin. Not so much immunoglobulins or other kinds of proteins. So it's most likely in albumin. When there is loss of selective albumin loss, that would be the first thing that happens. Well, I guess the first thing would be effacement of podocytes. And selective albumin loss would be the third thing. Now, following selective albumin loss, what happens to the plasma now? There's going to be a drop in osmotic pressure. So drop in osmotic pressure happens inside the serum. As the pressure drops, as the osmotic pressure drops, the compensatory process becomes stimulated. So we're going to have ADH being released in the blood, which is going to cause both water retention and some sodium retention, because water follows sodium. So if water is retained, some sodium is also going to be retained. So as a result, what happens is there is going to be more water being absorbed into our system. What's going to happen is, because of the lack of osmotic pressure, there is going to be edema, and because fluid from the serum is going to move to interstitium. Now, as fluid from the serum is going to move to the interstitium and there's going to be water retention, this edema is going to be exacerbated by increased ADH in the system, right? Now we have loss of protein and loss of osmotic pressure in the serum. To compensate for this, what liver is going to do, liver is going to increase production of proteins and lipoproteins, okay? And as a result, TAG, VLDL, LDL, all those are going to be increased. The production of all those are going to be increased. So now that we understand the concept of minimal change disease, now we can approach this question. Now the question says, choice A says, decrease in plasma aldosterone level. Aldosterone level is going to be increased because of the decrease in pressure. So choice A is not the correct answer. Increased renal sodium wasting. Renal sodium is not going to be wasted. In fact, sodium is going to be a little bit absorbed because water is being absorbed, right? So choice B is not the correct answer either. Choice C, increased capillary hydrostatic pressure. Increased capillary hydrostatic pressure, no, because more of the fluid is moving into the interstitium, so the hydrostatic pressure in the capillaries is going to drop, so it's going to be the opposite. So that is also not the right answer either. Choice D, decrease liver albumin synthesis. No, the albumin synthesis is going to be increased if anything, right? So choice D is not the proper answer either. It better be choice E. Let's see. Increased liver lipoprotein synthesis? Absolutely. So in this case, the answer is going to be increased liver lipoprotein synthesis.